have all rights. Are you immigration? You are not an immigration. This is my ID book. And this is my ID book. And then give me the right. No, you don't have the right. Come and take advantage. No.
Get out. Get out. Don't tell me get out. Don't touch me again. If you touch me again, I'll show you now. You're not going to be empty. Baba, don't touch me. Don't touch me. Don't touch me. Yeah. I'm not going out. No. I'm paying tax in this country. For which country? This country for 21 years. My business registration is 20 to honor paying taxes. Yeah, so why are you telling me not to be here? Why? Why are you telling me yeah? I'm a South African. I got my ID with me. I can't walk out. I can't walk out. Do your work. You can walk out. Yeah. I can't. Hello? Yeah, hello. South Africa got 100 and something companies in Nigeria. 100. They are using our hospital. You don't talk rubbish. They are using it for what I pay. Yeah. Sorry. What kind of stupid wicked people are here? Killing people in the hospital. It's very bad. This your attitude is bad. You are killing people. No country in this world will do that kind of rubbish you are doing. It's wickedness. Maybe you are from Mozambique or Zimbabwe. You come here claim South Africa. You are forefathers from Mozambique or Zimbabwe. You come here and claim South Africa. Killing people. You think you are fighting for right. That is not your right. You're just stupid. It's not your right.
Can you please come down?
Touch me now. I'll finish you here now. I'm serious. Touch me. Touch me. Three of you. No, what they are doing is bad. What they is bad. It's bad. You are chasing people that is pregnant from hospital. Where have they done such a thing in this world? Nowhere. Only South Africa. We helped you when you are in apartheid. We helped to bring you out. We sent millions. I'm not lying. If you don't go to school, go and read about it. Nobody can read about it. You don't mess up. No.
Turn that off.
No.
Turn that off.
No. It's bad. What is happening here is bad. If nobody will talk, they have to talk. Call police and arrest me.
Have all rights. Are you immigration? You are not an immigration. This is my ID book. And this is my ID book. And then give me the right. No, you don't have the right. Come and take advantage. No, you are not an. Are you an immigration officer? Are you immigration officer?
Yes, we are from the
I am from the security. This is my ID. I have an ID. You don't have right. No. Call an immigration. No. This is my
Security. Hey, back up.
Whether you like it or not, you can say that. It's fine. It's fine. And they change to enter here. Yes, then. What are you going to do about it? You're not going to enter here. You're not going to enter here.
Oh, I have an ID.
If you know yourself that you're not South African, please stand up. Please stand up. Please don't try and stand up right now. Stand up. Sister, are you South African? Are you South African? Because we are going to check everybody. Check them. Please, if you're not South African, come with me. Come. Come with me. Come. Come. Let them go out. That's what you guys are not South African. Go out. You can go to Unjani, Block P there, or Mutila Hospital. Go. Hey, fast. Because Zimbabwe, you run fast and go to the border. Madam South African. If you know yourself, what you do to South Africa, please stand up. If you know yourself that you're not South African, all these nurses and doctors, they are here for South Africans. South Africa. Please stand up. Don't try us. What's that? You run faster than border again. From a foreign again.
So start making arrangements. Let me say this. Now, today, when you get home, start making arrangements for where are you going to get that baby from? Where are you going to deliver that baby? Because here you are not coming. Pretoria West, you are not coming. We don't want you anymore. Start making arrangements where you are going to deliver the child, because here we don't want you. Yeah, you can go into Ramaphosa's house. He will help you deliver the child.
No, leader, even Julius Malema.
Yeah, even Julius Malema. Wrong person. Are you not pregnant? Are you not using our facilities free? Are you not using our facilities?
How much did you
What is wrong here? Because you are using our facilities. You came with a bag to give birth. You are using our facilities. So we are not talking to the wrong person. We are talking to the right person.
You must go back to your country.
You came here to give birth.
We don't want you anymore.
Yes. So you can't say you are talking to the wrong person.
Which one? You are here. It's you who are here in South Africa. What does that mean? You are not a South African.
Yes.
As long as you are not a South African. Especially you kill our brothers.
Yes.
Yes.
Your brothers are killing us.
Yeah, you will die for the Zimbabwe. For the Zimbabweans that are killing us.
Where are you from?
Where are you from? Are you foreign?
I'm not my country.
Where are you from?
Yeah.
Yes.
If you know yourself that you're not South African, please stand up. Please stand up. Please don't try and stand up right now. Stand up. Sandra, are you South African? Are you South African? Because we are going to check everybody. Check them. Please, if you're not South African, come with me. Come. Come with me. Come. Let them go out. You guys are not South African. Go out. You can go to Unjani, Block P there, or Mutila Hospital. Go. Hey, fast. Because Zimbabwe, you run fast and go to the border. Hurry. Madam South African. If you know yourself, what you do to South Africa, please stand up. If you know yourself that you're not South African, all these nurses and doctors, they are here for South Africans. South Africa. Please stand up. Don't try us. What's that? You run faster than border again.
See, relationship here how? A foreign man is not our relationship. We are not going to fight for South African needs and South African privileges. Boyfriend or how? Your boyfriend, if your boyfriend or husband is foreign, must go to a private clinic there or private hospital. Your relationship, your romantic relationship with a foreign man is your relationship and it's a personal relationship. Your man is not a boyfriend for all South Africans. Nambuto. We are not in a relationship with your man or your boyfriend. We are South Africans. You hate with your boyfriend and your foreign man. Don't force us into your relationship. Let's say happaleta, mon. Boyfriend ta how e jola lo na jola South Africa. Who bro?
Who wants that?
Boyfriend ya how? Ya the foreigner. E jola le wena, ha jola le South Africa e hotle. O sa re happaleta.
You from what? Malawi. Aye, hambe Kunjani. There is a clinic down there called Kunjani. Down there you can go and pay. Buya Malawi. Bantu bethu angithi nazi bantwana basekhaya ukuthi sinabantu base South Africa baboshiwe eZimbabwe. Ene ugovernment waseZimbabwe akasibhayi isikeleme. Usho kahle ukuthi yena akasibanana country. Then ushukuthi thina siyibanana country. Fanele bahambe bazothatha imithi yethu, bathatha amaphilisi wethu, bathathe yonke into yethu, bahambe babuyele emakhaya. So mabaphume. Ngicela ngiphumeni sis. Ubuya ekhaya. Akakwazi nokukhuluma. Ubuya ekhaya sis.
So if someone would tell me that in 2025 we'll be talking about South Africans denying foreign nationals access to medical care, I won't believe it. Now I get it. The public hospitals is meant for South Africans. That's understandable. But you cannot tell me that there is a law, useless law, banning foreign nationals from having access to public hospitals, and you are directing them to private hospitals. We all know that all over the world, private hospital most of the times doesn't have, licensed doctors, experienced doctors. So you would want to go to the public hospital. Public hospitals, we can also regard them as government hospital, where you have trained doctors, experienced doctors, some of them 20 years, 30 years, 35 years, and the likes, and they will be able to handle your medical issue. So you are directing them to the question here is not before they will tell you is illegally immigrants. They are no longer talking about illegal immigrants. So what they are talking about now is foreigners. These guys, they are not even law enforcement agents. They are not even immigration officials. So they just recruit themselves, jobless guy recruiting themselves to be causing nuisance to foreigners. Now, what I can make do of this is that this is just selective law enforcement, section 17. I would like to go through their useless section to know what is written there. Selective law enforcement. Do you want to tell me that an American who you just visited South Africa, maybe had some kind of health issue, want to have access to the public clinic or public hospital, and they will be enforcing this law to an American? They'll be enforcing this law to someone from UK, someone from, let's say, Chinese man or so. We Africans, we are our own undoing. Why do you think that all over the world they are always disrespecting Africa? In among ourselves, we are our own undoing. Imagine South Africans, these people that are there, most of them that are standing here, the other one is a newsman. You are not even licensed. You are not even licensed, approved by the government to do this job. You just felt like because you are jobless, you have no job. I love Julius Malema. Julius Malema was in Nigeria during the NBA conference. He said the South Africans must admit that Nigeria is not the cause of their problem. Nigeria is not the cause of unemployment. Now, this is no longer a case of foreigners taking the jobs. There are any misfortune in South Africa, anything that is not going well in South Africa, they blame foreigners. There are cases of drug, they say that it's foreigners. Crime rate, they say that it's foreigners. Now, this is medical care, public hospitals, public clinic that is run by the government, funded by the government. So if you are going to do that, why can't you do it in a way that is sensible? You said, okay, yes, there are people at the hospital, you put up security officials there, and then they'll be checking your IDs. Since your ID is now your access ticket to heaven. You'll be checking these IDs. Now what you are doing is just embarrassing people that have booked this hospital, they have a session with the doctors, you are preventing them. What if these people die in the process? And then you will come out and tell us that according to section 17, according to section 17, they are not supposed to have access to public hospitals because they are foreigners. This is unbelievable. I've never had it in this fashion before. What I used to hear from South Africans in the past, that foreigners, illegal immigrants, they need to go. Nigerians need to go to their country. Now these are for now. You should have even asked them. What if they have the money to pay? Because for me, I wouldn't want to go to, except if it's a critical matter, I wouldn't want to go to private hospital. I love government hospital because government hospitals have trained doctors, experienced doctors that know how to handle your medical emergency or medical issue. So why are you referring them to private hospital? Now also, private hospital is costly. It's not everybody that can afford the private hospital. So why would you guys be referring foreigners to private hospitals when you know that private hospitals are costly and is not what any random citizen, any random individual can afford? So you are directing them to private hospital, which is clear-cut wickedness. And even the way they are addressing these people is not even funny. Look at the other guy telling an elderly man, "Shut up, listen to me, run back to your country, do this." It's really crazy. We've never had it in this fashion before, and it's even a shame that in 2025 this is what we have to talk about. If there is unemployment rate in South Africa, do you even know that most of the medical professionals that are in their public hospital or government hospitals, most of them are foreigners? So why are you engaging foreign medical professionals? Why don't you use citizen, resident, those that have ID? So a report has it that South Africans have so many medical professional, a nurse, a doctor, a pharmacist. Most of them are foreigners working in South Africa. So why can't you make it all South African nurses, all South African doctors, all South African pharmacists? But they still have foreign nationals. So this is unbelievable. Do you know that there are so many South Africans in USA, in UK, Europe, and other parts of the countries of the world, and they have access to this free medical care? In UK, NHIS, they have access to this. Are we even going to be talking about illegal immigrants, South Africans that have overstayed their visas abroad, and they are still there, no one is disturbing them? Most of them are also having access to free medical care. And in 2025, another bizarre topic coming from South Africa is that foreigners should not have access to public hospital. If you are saying that foreigners should not have access to free medical care, I understand. But what if foreigners have money to pay? Because I know even in that public hospital, there is also a chance for you to make payment, for you to pay and be attended to, because it's not everyone that has South African ID. So every jobless individual has become a law enforcement agent to embarrass foreigners. And we're having this discussion in 2025. To me, it's really, really crazy. It's unbelievable. I've never had it in this fashion. Among ourselves, among Africans, this is what we have to discuss. Selective, like I call it, this is selective law enforcement. Because if an American walks in here, like we already know, there are so many things I wouldn't want to say in this video. If an American wants to have access to this public clinic or public hospital, are you going to tell the American you don't have to access are you going to tell the American you don't have to access a public hospital because you are a foreigner? It's only for South Africa. Look at Zimbabwe, Malawi, and the likes. Zimbabwe, Malawi, these are the people they are oppressing. It's a shame. If you are saying that foreigners are taking the bed, does it mean that are they forcing themselves in there? They book a session and they have an appointment with the doctor, and this is not illegal. This is legal. They follow the whole due process. And you are saying South Africans don't have beds, so you are saying that all the South Africans all the foreigners coming to South Africa, they are just coming in there just for medical treatment. It's really, really crazy. It's really crazy. This is terrible. This shouldn't even be seen anywhere, but it's already trending. Videos are all over the place. It's trending. South Africa projecting themselves to also as a country where xenophobia has not even been destroyed, has not been killed. Nigerians are even the one facing the heat. From somehow the Nigerian shops are attacked. Do you know in Nigeria currently South African businessmen have so many businesses established in this country? We have ShopRite, we have DSTV, we have so many South African businesses thriving, and no one is disturbing them. They are not even taxed so high. So South Africa wants us to believe that they have arrived, that everything is moving well for them. They don't need help or they don't need anything from any other African. So they are now maybe the world power. Well, time, they say, we tell.
Should I give you the number for the private? No, my son will do that. Oh. It's only that I thought it's just as easy as being accepted. No, it's not. No problem. Thank you, Papa.